Nowadays, dentistry has evolved into something very different than what it used to be in the past. The dentist does not only seek to relieve us from toothaches, but also to offer a wide variety of services regarding not only the prevention, but also the rehabilitation of functional oral problems as well as aesthetics. The oral cavity is a sensitive area of the body, constantly exposed to the air we breathe and to food. The enemy of teeth are the bacteria and the toxins they produce. On the surface of our teeth, an invisible sticky film is created, the bacterial plaque. Plaque bacteria use starch from food to produce acids which dissolve tooth enamel, causing caries. Plaque reacts with the salts in our saliva and thickens, turning into tartar. If this remains in our mouth for a long time, it leads to serious diseases such as periodontitis, which is not always painful, nor has other symptoms, but could even lead to teeth loss in the future. The best way to save ourselves from these risks is, first of all, proper oral hygiene, and then frequent checkups by our dentist. The most important step of this process is correct brushing, at least twice a day, in the morning and in the evening, ideally after each meal. It is worth mentioning that brushing our teeth in the morning doesn't need to be done right after we wake up, but after breakfast, since food debris between and on the teeth is the main cause of tooth decay. It is also absolutely necessary to brush our teeth before going to bed, since the quantity of saliva, along with its antibacterial properties, is reduced during sleep. Now, how to brush your teeth correctly? Brushing our teeth quickly for 30 seconds doesn't clean them. It just gives a sense of freshness. We need at least 2 minutes for a proper brushing, while in some cases, depending on the state and anatomy of the teeth, we might need even more time. This is something our dentist will tell us. Try to feel the moves of your hand and the way the brush is placed on the teeth, along with its movement on them. Place the brush horizontally on your teeth, directed with a 45-degree angle towards the gums. Start by brushing in small circular movements, trying to feel your movements on each tooth separately. It is important to feel the toothbrush bristles gently inserted into the dentogingival crevice, which is the line between the gums and the teeth. Make sure to brush with short and quick movements on each tooth separately. Once you have brushed the outer surface of the teeth with upward and downward movements, do the same thing on the palatal surfaces, which are closer to your tongue. On the palatal surface of the front teeth, both up and down, the brush is placed vertically, not horizontally. We leave the occlusal surfaces for last, brushing with movements back and forth. Pay attention to areas that are difficult to access, like crooked or crowded teeth, or wisdom teeth that have just started to erupt out of the gums. In the end, we also clean the dorsal surface of the tongue, either with the toothbrush or with a special tongue scraper. Brushing, even when done in the most correct way, cannot clean the areas in between the teeth, the interdental spaces, where the teeth are very close to one another. These areas are very important, since that is where most cases of dental caries start. These are the areas where we have to use dental floss or interdental brushes. Additionally to brushing, we use mouthwash, preferably one without alcohol, so as to avoid any caustic reaction to the mucosa. Fluoride in the mouthwash is one of the most effective means of protection against dental caries, while others have special antimicrobial agents that fight oral infectious diseases. If we take a look at our teeth, we will realize that they do not consist of smooth, flat surfaces, but instead they have a complex morphology. Especially in the back teeth, the horizontal surfaces that contribute to chewing have intense crevices. Scientific research has proven that in some cases, depending on the anatomy of the teeth, even thorough brushing cannot remove bacteria trapped inside the crevices of occlusal surfaces. Certain dental anomalies provide an ideal place for bacteria to hide, which multiply and expand innocuous action. When it comes to this serious problem, the solution is sealants, the preventive fillings of holes or crevices. These are thin films that cover and block teeth openings and crevices. In this way, these vulnerable areas are much less prone to accumulating bacteria. Sealants are mainly used as a preventive measure in the case of children. And since we're referring to children, we shouldn't forget frequent teeth fluoridation every 6 months. Lastly, an important factor is our nutritional habits. Sweets, sodas with sugar, or carbonated drinks and sticky foods without fibers destroy our teeth pretty easily. Our regular appointments to the dentist once or twice a year are crucial, not only for early diagnosis and treatment of oral diseases, but also for the correct prognosis and maintenance of the result. The dentist will examine thoroughly the state of the teeth, gums, and the whole oral cavity in general. If it is necessary, the dentist will take a few X-rays in order to determine any teeth damages that cannot be identified with a simple checkup. Thanks to frequent appointments, we are able to identify dental caries while it is in its primal stage and before it expands. It is important to cure an early gum infection before it evolves into other more heavy forms of gum or bone diseases, like chronic gingivitis, necrotizing ulcerative gingivitis, or even periodontitis. Remember that a neglected mouth may cause infections that may possibly threaten our health in general. Moreover, the first symptoms of several illnesses appear first in the oral cavity. Regular appointments to your dentist may help you discover promptly some other ailment that may bother you or that may bother you in the future. Additionally, you should remember that teeth with dental caries, fillings that have been altered over time, and periodontal diseases, gingivitis, periodontitis, cause bad breath with unpleasant results to psychology, both our own and our direct environments. Also, chewing food with fewer teeth than normal is not performed correctly, and when the situation is prolonged or neglected, it may cause problems to the stomach, which finds it harder to digest our food. The same situation often causes abnormal jaw movements and, as a result, the jaw joint, the temporomandibular joint, starts to get damaged with symptoms such as noises, difficulty in opening and closing the mouth, and intense pain. No matter how good our oral care is, with the method of oral hygiene we follow, we also need a regular contact with our dentist on frequent periods of time for a general checkup, but also for a dental cleaning. So, let's remember that for the dentist's work to be successful, he or she needs us as an ally.